Due to the current pandemic and the increase in COVID-19 cases, hold times are longer than usual. We are doing our best to handle your calls as quickly as possible. Please make note that on Wednesday, April 27th, the office will be closed until 3:30 p.m. for an off-site staff training. Thank you. Hello, and thank you for calling Endocrine Associates of Rockland. To provide you the best service, our calls are monitored and recorded. Friday alert. The latest time for prescription call-in on Friday is 2 p.m. If you are calling from a hospital or doctor's office, press 1. If calling for an appointment or lab results, press 2. If you are a patient or a pharmacist and would like to renew a prescription, press 3. If you are an insurance company or require medical records, press 4. For billing, press 5. For our address and fax number, press 6. For directions, press 7. All others, press 0 or stay on the line for assistance. Thank you.
Your call is important to us. Your call will be answered in the order. Endocrine Associates, Maria speaking. How may I help you?
Hello, would you know if there's any way, first off, are Utica or Jackalow there today?
Is Utica or who? I'm sorry?
Utica or Jackalow, the dietitian, there today?
Deborah, let me check if Deborah's here.
Because I have to, that would probably see if I could answer the question.
Deborah's not here. Dr. Utica. Sorry, hold on.
I'm sorry.
I'm just checking. Yeah, Deborah is not here. Dr. Utica is not either. She probably either left or is about to leave.
Oh, because I need to make an appointment on Monday or Tuesday to get the lab to put in a sensor for the Dexcom CGM, if that's possible. And usually one of them is the one that tell them to do that, because otherwise they don't seem very willing to do that without them telling them to do that. So I'm wondering if you could help me with that.
Yeah, I'll definitely, pass on that message. But can you give me the date of birth, please?
My date of birth, 12/16/1983.
What's the last name?
Newmark, Newmark. I actually meant to make the appointment for today, but I forgot to, and the thing is expiring at about 8 o'clock anyway, so I'm sorry.
No, it's okay. You mean for labs, right?
Well, I need to get a new sensor put in for the Dexcom, so they are the ones who usually do that, assuming one of the two asked them to.
So you need patient needs new sensor. You need new sensor for Dexcom?
Yeah, for the CGM, if you know what that is.
Yeah, for the glucose monitoring. And you want the lab to be aware?
Well, I need them to do it because I can't do it myself. And as far as I know, they won't do it. They've been unwilling to do it before if Utica or Jackalow don't tell them to. And in that predicament, I can't ask you for a specific time, I guess, that I could come on one of those 2 days, right? Unless they answer the
Not
message
until,
first.
yeah, exactly. But she's usually,
So I'd probably be asking for Tuesday rather than Monday in that case.
yeah.
Which is actually better in my case because I have a trip spots on Monday anyway.
Yeah, let me see something. Okay, please hold.
All right, thank you.
Thank you.
Office hours are 9 a.m. to 5 p.m. Monday and Thursday, 9 a.m. to 8 p.m. Tuesday and Wednesday, and 9 a.m. to 3 p.m. on Friday. Our telephone lines close at 4 p.m. Monday through Thursday and at 3 p.m. on Friday. Please continue to hold, and our office staff will be with you as promptly as possible. Endocrine Associates of Rockland is on your team when it comes to diabetes management. Our doctors know the important role that diet plays in treating diabetes, metabolic syndrome, high cholesterol, and obesity. That's why we have 2 board-certified diabetes educators who provide vital information about nutrition and healthy lifestyles. They recommend diets and exercise programs designed with your individual needs in mind. You'll discover that a healthy diet doesn't have to be bland or boring. Ask about our nutrition program when we return to your call. There's a painless, non-invasive way to get the information necessary to treat conditions of the thyroid and abdomen. It's called sonography, and more commonly known as ultrasound imaging. Endocrine Associates of Rockland uses sonograms to provide our physicians with detailed information to deliver the most accurate diagnostics available. Our highly trained, board-certified technicians use this safe, painless, and non-invasive procedure to ensure you get the best possible care at Endocrine Associates of Rockland.
So Deborah won't be here Tuesday. Does Wednesday or Thursday work?
My only problem is I have another doctor's appointment on Wednesday, and on Thursday I have work. So.
Yeah, so I'm gonna send a message out to Deborah, but just to make you aware that she's not here on Tuesday. So
I thought she was usually there on Monday and Thursday, if I'm not mistaken.
Yeah, so it will have to be either Monday, or Thursday.
Can't she leave them the message on Monday to do it on Tuesday, or that doesn't work that way?
I'm going to, because I believe the last time they had a little problem, because it's usually Deborah who installs those things, not the lab.
What do you mean? I'm sorry.
Usually, Deborah is the one to do the sensors.
Oh, you mean she actually does it herself?
Yeah, so usually that's how it goes, but that...
Is that why they're so insistent on not wanting to do it, I guess?
Yes, because that's something they don't usually do. So, I will send a message right now to Deborah, and I'll ask her what she will have me do, and I'll tell her that we'll only be able to do Tuesday or Monday.
Okay, and when do you think you'll be able to get back to me by?
Maybe I'm most likely gonna give you a call either by end of day or Monday in the morning.
Okay, forgive me for asking. I thought that you could close in like a half hour or something.
The phone's closed at 3, but I'm gonna be here a little bit more.
Okay, so it still could be today, but by Monday morning, you said.
Yeah.
Okay, and one other question, if you don't mind me asking as well. I can't remember exactly what it was, but there was, because I can't find the appointment card, but there was a lot of Utica appointments or Jackalope appointments, I forget which one, bunched together on there. Is there anything I could do about that, or?
Give me 1 second.
I'm sorry again for the convoluted question. And let me see if I can find that while I'm waiting. Yeah, for some reason I have one on April 28th, and then I have one on May 26th. That was one question there, if that's okay.
Um, okay, hold on.
And then I have one other here as well, if you don't mind.
Okay, give me 1 second, okay?
Thank you.
So what's the first question again?
I have an appointment for Jackalow on the 28th, which I think is next week, as well as the 26th of May, which are right on top of each other. Should it be that close together, the two appointments?
Let me see. So on your last visit note, let me see how many times do they want you to see that diabetic educator.
I thought she was a dietitian, but
Blood,
okay.
I don't know. So blood work, 6 weeks follow up after. That's only set for that one. But when was the last time you seen that? I don't know why you have that many appointments with Deborah so close together.
Yeah. And then the other question I had, if you don't mind, I have a lab appointment for May 20th, and then a Utica appointment for June 3rd. I thought the lab appointment is usually the week before the Utica appointment, but I have the Jackalow appointment, like I just said, in between the two. So should I assume they want both of them to be able to discuss that, I guess?
Let me see who scheduled these.
All right, thank you.
Um, so 6 weeks. This is weird. Last time I seen Deborah. You haven't had an appointment with Deborah in a bit, right?
I honestly don't remember.
Yeah. So I will keep the one that's
The one that's next week, you would say. Actually, since it's on Thursday, and I didn't even notice that, would that be the time that you would recommend, if you can't do it earlier, to get that sensor put in?
I will have to see if.
Yeah. Because the only problem with that is I'm not sure if I can keep that appointment, since I have to rely on the public transportation and I have to get to work that day at 4:30.
Yeah, the thing is, all the other appointments are taken. Like this.
What do you mean, all the other appointments for the lab or for Jackalow?
Oh no, for Jackalow. Are you talking about the lab?
Well, I was just trying to get the sensor put in. You said she usually does that, supposedly.
Yeah. I'm gonna send out a message to her. Well, I did send out that message, but I'll write that if it's okay. I mean, are you planning to reschedule that appointment or no?
Well, the only problem is I need to see if I can get a way to get in there.
Okay, so by when would you be able to find out?
I don't know. That's kind of the problem. I need to figure out if I can get a taxi or an ambulette ride from Medicaid to go there, because my mother still has COVID, so she can't exactly help me, if you know what I mean.
So yeah, no, I understand. So I don't want to cancel any of these appointments just in case, because we don't have much room. Like,
yeah. Otherwise, you probably would have tried to make an appointment earlier in the week, right?
yeah. So let's see when what happens after she answers me. and then try to find out if you can make it in on the 28th.
All right, and you did say you'd get back to me by Monday morning, so I guess I'll see you after the weekend's
I'll try
over.
my best. Yeah, I'll try my best I'll get back to you either to let you know what she says or what we're gonna do, or to let you know if she hasn't responded to me.
Okay, and in the interim, until I'm able to get the new sensor on, you would say to use the remaining test strips I have for the glucometer, right?
I'm not able to say that. I have to ask somebody.
Well, I think they would usually say that, so I don't know.
I'm not sure. So you want to know that until you're able to come in, if you can, like...
Yeah, because thing is expiring tonight.
Oh, they're expiring, right?
Yeah. So I'll have a couple of days at the very least, without that.
Expiring. What are the name of the test strips? Maybe you can get a refill.
No, I have the test strips here.
Oh.
I'm saying I don't have that many left, but I have them.
Well, you said that they were expiring tonight.
No, I was saying the CGM sensor was expiring tonight.
Oh, the CGM sensor is expiring.
It would be very exact to say that the test strips are expiring at 7 p.m.
At 7 p.m.?
Yeah, 8 p.m. actually in the case of the sensor, but...
8 p.m. All right, I'll let her know. I did send this with, high priority, so she'll definitely see it on the top of her list.
Okay.
All right, so I'll get back to you as soon as I can, okay?
Okay, sorry to ask. Who was I speaking to, just so I know?
Maria.
Okay, have I spoken to you before, or...?
No, I'm new.
Okay, thank you then, and have a nice day.
You as well, take care.
17:29, and it's right now 2:40:22.
Hello?
I just had a very long conversation with Utica's office, just so you know.
Oh, how come?
For one thing, I was trying to make an appointment for Monday or Tuesday to put in the new sensor, and they said they didn't know if they could. They would get back to me either today, because they're closing in about an hour, or Monday morning to see if they can. And then I realized that I have an appointment with Jackalow on Thursday that I have no idea how I would possibly get to, because I have work that day. So... Because I'm not really sure how you're going to be feeling by then.
Right. Well...
It would be so much easier just to put things on Marlene if she was here.
Ben, leave her alone.
Oh, she's supposed to be my servant at this point.
You could almost see if you could speak to Jackalow over the phone, if possible.
Yes, that would be wonderful, except for I need her to put in a sensor. Remember I just said this?
Yeah.
I can't do that over the phone, obviously.
So why'd you stay on the phone? Why'd you talk to them so long?
Because I was trying to get them to leave messages for either Utica or Jackalow.
Oh, okay. All right. So I bought you those salmon burgers.
Why?
Take up a lot of room. Because I'll have them around the house.
Yeah, but why didn't you get the hamburgers?
Oh, I don't know. They had some sort of Tyson chicken panko thing that was on sale. So I got a bag of that.
Did I ever have that before?
I don't know. But
I want to say you got me a panko thing once, but I don't remember what it was exactly.
Oh, okay. Well, in the meantime, I got you that, and I figured next time I'll buy the hamburgers. I know.
By the way, I'm getting very frustrated with Colin/Malachi/Patricia now. Patricia is claiming she didn't tell me not to worry yesterday, even though I know she did. Colin is, like I said, saying that I would need to fill out a form in order to not work on Monday, which I don't understand. And then when I called Patricia the last time, because she told me to call her back because the store was busy, She supposedly said she would talk to Colin to get a different person working on Monday. The problem being that she said if he gets upset at me, I would have to deal with it, which I don't know why he'd get upset at me if Malachi is taking off.
Exactly. None of this makes any sense at all.
So.
None of this. I think they're giving you the runaround, Ben. They're trying to drive you crazy, and that's not right.
And remember that there was that other thing on Monday that Malachi was on my side with regarding the counting and Colin. Remember?
Right. Yeah.
So.
Ben, I'm driving now.
How are you driving? It sounds like you're in the parking lot.
No, I'm driving. I'm on now. But
So you have your Bluetooth, don't you?
Yeah, but I really don't. I like to concentrate on driving. I like to listen to my radio.
Oh, so you're still listening to your musicals?
Yes. Okay. Go out. It's very nice out.
I was cold before, and I thought you wanted me to eat something.
Oh, yeah. Go eat some.
I was trying to ask you something about that. Andrea said that the deli does not last very long in the refrigerator. I got it on Wednesday. Should it still be good, you think?
It should be fine. Go eat it.
So eat that, you think, before it gets rotten, then?
Yes.
It's
yes.
turkey pastrami, the one that I have left. Is that good?
Oh, that is very nice.
Because I like pastrami, and turkey is healthy.
Right. You only bought one, or you bought...
No, I also got that executive turkey breast, whatever that was, and I ate that night.
Okay, so go have this now. It sounds good.
All right. So, like I said, pastrami I like because it has that pickled stuff, I think, right?
Yep.
All right. Should I presume that you're going to be home soon? I could call you again if I need to? What?
We'll be home soon. You don't have to call me, though.
All right. Do you want me to tell you the number that's in here for the last 2 hours that it's giving me? Because it says it's actually... Wow. It says it's going to expire in 30 minutes. It's giving me 159.
Okay, go.
So do I need to take a lot of log for that if I'm just going to possibly eat meat? Mom? And you hung up. 503.
Hello?
Can you hear me or not?
Yeah, I hear you. What's up?
For one thing, how are you doing? Did you ever test negative yet?
No, how do you test negative? They say you can test positive for 3 months.
So why did Andrea and Malachi both test negative about 2 weeks after they first tested positive?
Positive, it's possible, and then on the other hand, they could have tested negative or positive.
Well, all I know is I started working with both of them again, and never was there a problem.
Wonderful. That's good. I hope so, too.
That's why I'm wondering if you're negative yet.
No, you can't just keep taking test after test after test.
That's the point. You're supposed to do it every 5 days, according to Malachi, when he had it.
I don't know. To me, it's just been 5 days, and we're going to see where we go from here.
Yeah, because you've had it for about 2 weeks, am I wrong?
Nope, I just tested positive last Sunday.
Are you sure? I thought it was the week after you came home from Florida.
Nope.
Speaking of which, by the way, I forgot, actually. How long has it been since you came back from Florida?
I don't remember, but I think we came home...
the week before Passover, right?
Maybe the 3rd, maybe.
But it was the week before Passover began, right?
I guess Sunday the 3rd.
What did you say, the 3rd?
I think so.
Okay. And I have one other question, two other questions. One, if my number is 159, how much log would you recommend me take if I'm just eating really deli meat?
I don't know.
Why don't you know?
What does Mom tell you to take, 120?
No, she tells me to take 20 a log. You're thinking of the Tujeo 120.
Oh, okay. So then take 20.
Okay, that's usually if I have a low number, though. Anyway, also, the other thing was, why on my Glumeripride bottle do I have a year from last year? It says refills, 2 by 9/24/21.
So then I don't know why. Maybe they made a mistake. Is there an expiration date on the bottle?
Yeah, it just said 9/24/21.
No, I'm not saying prescription label. I'm saying on the bottle itself, is there an expiration date?
Sort of, but I can't make out what it says. It says something about 622, 322022. So I don't know what that means.
I don't know, then. I mean, you have to read it. It should say a month, date, and year.
It doesn't. And I thought that's what the refill thing was.
No, it says on the. What does it say on the label? What does it say on the date filled?
3/23/2022.
Okay, that means it was just filled in March. And then it says how many refills until when?
I just said 2 by 9/24/21, which makes no sense.
Okay, and then it says discard this medication by when?
It doesn't.
It will. It's on the label. It's printed by the pharmacy.
I'm saying it doesn't say that.
Well, it should. I can't see it. You want to send me a picture? I'll try to read it.
It's not there. I'm telling you it's not there.
Okay, then I can't help you. You have to call the pharmacy and see if the medication is current.
They say it was. They say I'm due another refill at the beginning of May.
Forget the other refill. You want to know?
No, I mean, they're saying if this was just filled when it says it was filled, then it should be fine.
Doesn't matter. It has to say when it expires. Ask them when it expires and where you can find it.
And why would I do that?
To know whether it's a current medication or not.
It has to be. It's the only bottle I have.
Doesn't matter. They might have given you year-old pills.
Oh, you're annoying. All right, I was going to eat. Bye.
All right, eat. Pharmacy, how can I help you?
Hello, my father's giving me an issue asking me when this thing expires. I don't see an expiration date on the pill bottle, if you don't mind me asking. Where is that supposed to be usually?
Expiration? Give me 1 second.
All right, sorry about that.
And minerals could be the cause of some side effects experienced by some people. It may be that you could benefit by asking our good neighbor pharmacist about new formulations of nutritional supplements that are specifically designed to be taken with certain medications. Thank you for calling. We will be answering your call next. True Care Pharmacy is on Facebook. Our page is updated daily with important and interesting health content and even has some fun giveaways for our patients. If you haven't given us a like, stop by our Facebook page today. We are working very hard to answer your call quickly. Thank you for holding. We all know taking our medications correctly is important to staying healthy. But what happens when that becomes hard to do? True Care Pharmacy offers a medication packing service to solve the problem. Our True Pack service stores all patient medications in store and uses them to fill weekly, bi-monthly, or monthly medication packages. These packages are easy to use and make remembering to take medications easy. Just another service we offer to keep our patients happy, healthy, and in their home. Ask a staff member about our True Pack service when we answer your call, and thank you for holding. Are you tired of coming into the pharmacy to pick up refills every week? While we love to see our patients, we understand if you are tired of stopping in all the time. When we get to your call, make sure to ask about our Refill Sync program, where all your refills could come due one time each month. For a full list of our services, visit us online at truecare-pharmacy.com or visit our Facebook page. Thank you for holding. We will be with you very soon. Did you know that over 53,000 children ages 4 and younger are treated in U.S. emergency rooms for accidental poisonings every year? Remember to store medications in their original, child-resistant bottles and out of reach. Thank you for holding. We'll be with you momentarily. The iCare Health Plan Benefit Card Program for Medicare members allows you to purchase Medicare-approved over-the-counter or OTC items at your convenience. You'll be able to save money on over 100 OTC medications and supplies, such as pain relievers, cold medications, dental care items, first aid supplies, and more. Ask for details about the iCare Health Plan Benefit Card.
Sugar Pharmacy.
Hello. I was asking a question about the same pill bottle I was asking about before. My father seems to think there should be an expiration date on it. I don't see that.
On which?
On the Glumerepride?
What do you mean?
All I see on here is it says refills 2 by 9/24/21, which already passed. So my question is it still okay to take? Because my father seems to think it might have expired.
When? Say it again.
What?
Can you repeat that?
The expiration date says the refills date says 9/24/21. So is that still okay to be taken? Because that's the only bottle of Glumerepride I have here.
Yeah, that's the refill date.
So it still should be good?
Yeah. It's, and you're getting a new refill soon.
I was told before by the first week of May, I think.
Yeah.
So I should just use this until then, I guess?
Yeah, it should be fine, but I'm going to check with the pharmacist real quick.
Okay, and sorry to ask as well. Would you recommend throwing away the old pills once I get the new ones?
Let me ask the pharmacist that question, actually.
Okay, thank you.
Yeah, thank you. Hold on 1 second, please. Or I'm going to just transfer you over to her, okay?
Okay, hopefully it's not long, thank you.
Yeah, no problem.
All of your home care needs with prompt, personal service. We also stock all those household needs on your list, including health and beauty products, cosmetics, vitamins, and baby care items. We carry everything from walkers, canes, and crutches to post-surgical supplies, wound care items, orthopedic supports, and diabetic supplies, including sugar-free candies and chocolate. You'll find blood pressure monitors, compression stockings, and many other quality products. If we don't have what you need, we will be happy to order it for you and can often get it in the next day. Please hold. We'll be with you in just a moment. During your short moment to browse through our gift gallery, where you'll find unique collectibles, frames, children's toys, and much, much more. And to complete your gift purchase, we carry designer greeting cards, gift wrap, and gift bags, always discounted at 50% off. We will be with you in just a moment.
Trigger Pharmacy.
Hello, is this the pharmacist?
Yes.
Oh, hi, this is Ben. I was calling about the Glumerepride again. My father seems to have an idea that the pills might have expired since the refill date says 9/24/21. Would you assume they're still good?
Yeah, no, there is another bottle you have in the house. That should be different. It was done on 2/4. What's the fill date?
On the bottle that I have?
Yeah, the fill date.
6/23/2021.
No, there's not that date. There is another date on top. It says fill date.
That is the fill date.
No, then there is another. Let me see if we filled it on that day. The one we just gave you was
Maybe I
in
put it in an
February.
older bottle? I don't know.
Yeah, that is an old bottle. There is one that should say fill date of February 4th, 2022.
Yeah, that's the bottle I have. I'm guessing maybe I put the pills in an older bottle? I don't know.
No. The date you're looking is probably the issue date.
No, the written date, if that's what you're referring to, says 9/24/20.
So then that is an old bottle.
Yeah, that's the one I'm using right now. Like I said, maybe I put new pills in an old bottle. I don't know.
Right, that's
but
possible. So that's why next time just throw the old bottle out and start with the new, because the information on it, that's, is a new information.
well, that's why I was asking the other question to the other guy before. When I get the new pills, which you said I would get in a couple of weeks, should I throw this bottle away?
If you want to, because I'm not sure if that's the old one you carrying it or you poured it in there. I have no idea.
No, that's what I
about
mean.
that.
Presumably when you give me the new bottle, it will
Yeah,
be
so
enough
that's
for...
fine. I mean, it doesn't expire overnight, trust me, even if you took it. So until you get a next one, just keep that one.
All right, so it should still be okay now, either way.
Yes.
Okay, I'm sorry for bothering you.
Okay,
Thank you.
try to keep the new one next time and just throw the old one out when you get a new one. When it's finished, obviously, don't throw the medication out.
Oh, I thought you were saying throw the medication out if it expired.
No, the one, not right now. I'm saying next time when you get a new bottle, if you finish it within reasonable time, you're okay with that.
Well, I can't throw it out now because that's the only ones I have, so...
Right, so you're going to take that one now, I'm saying.
Okay.
So we'll send you a new one when it's due.
All right, thank you then, and have a
Okay?
nice day.
All right, you too.
8:40, and it's right now 2:59:39.